Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, whatever the injury is, if I and any orthopedic surgeon, we kind of all face this, whenever we're talking about surgery, one of the questions that people ask, or maybe one of the questions they should ask, is how likely is this surgery going to work? Is it going to re-tear if it's a repair of sewing something back together or making a new one? How likely is it that I'm going to get back to work or to school or to sports or exercise and suffer another injury? Basically, either it didn't heal the first time or it re-tears. And so in today's Ask Dr. Geier video, I answer that exact question about arguably one of the most common injuries in all of orthopedic surgery, and that is a meniscus tear. Okay, Anne-Marie asks, Dr. Geier, my 14-year-old daughter had a horizontal meniscus tear that was in the white area spread across most of the meniscus. The top had flipped back into the kneecap. The amazing surgeon pulled out the flap and put 9 stitches inside out and reinforcements on the edge. We're prepared to follow the rehab path 4, 6 months, or whatever it takes. She'd like to return to competitive basketball at 8 months. If she returns, what are the chances that the sutures will not hold and it will just re-tear? Is there any hope that this area will heal, or is it susceptible to re-injury regardless of the long rehab time? It's a terrific question, no doubt about it. So just as a background, the meniscus is the C-shaped shock absorber. You have one on the inside and one on the outside of each knee, and it can be torn with a variety of twisting motions or deep bending motions, but it's a shock absorber in the knee. Some of these meniscus tears have to be trimmed out. They occur in certain locations that basically there's no blood supply, that even if you tried to sew them back together, it wouldn't heal, and so we go in and trim them out. Especially in adults, that's far more common than a repair, sewing it back together. But if you can repair the meniscus, if the tear is in a certain location that you can sew it back together, and that's typically a certain type of tear and it's in a certain location that there's still blood supply to that part of the meniscus, you want to repair it because that preserves the entire shock absorber, minimizing the chance that you develop arthritis changes down the road by not having as much of the meniscus to serve as a shock absorber. That assumes, though, that the repair of that meniscus actually heals. And there's a variety of ways to do it. She mentioned inside out, where basically you do it through the scope, but you use these specific types of sutures and needles. They're on really long needles, and you put it through the meniscus, and then it comes out a small incision in the back of the knee, and you pass the stitches from inside the knee to outside of it until you sew it back together. We also have a lot of new implants that are all inside, so you don't have to make a big incision on the outside of the knee, and basically you reattach it, or not reattach it, but you repair it that way. Now, again, that's a much less common surgery than trimming out the meniscus tear, but if you can do it, especially in your young athletes, that's always what we like to do as orthopedic surgeons. But what she gets at is actually a really common thing to think about when you're thinking about a meniscus repair, and that is, how likely is it going to heal? You put stitches in it to sew it back together, but is that going to make it heal? And the short answer to that is no, there's no guarantee that that works. The stitches are basically just holding the meniscus edges together until the blood supply of that meniscus brings in inflammatory cells that get it to heal, and that process takes months. And so that's why after a meniscus repair, unlike the trimming out, after a meniscus repair, a lot of times we'll put that, the patient, the athlete, in a brace, put them on crutches, maybe not even let them bear weight for 4 weeks, maybe 6 weeks, and the overall rehab is a lot longer because you're protecting the repair, but then it's a lot harder to get motion and strength back. But the key is that you're doing what you can to get that repair to heal. If you do too much too soon, you risk the stitches breaking and basically it doesn't heal. Now, getting back to how likely that is to work, we know that those have good results, but probably not great results. I actually just reviewed an article, I think it was last night that I actually read this, and it was in the American Journal of Sports Medicine, or one of the sports medicine journals, and it looked at all these studies of meniscus repairs, put all the data together, and it was about a 10 to 15, I think, percent re-injury rate, or basically they didn't heal, failure rate essentially of the repair. But there are studies that show the failure rate is as high as 20 to 40%. And again, that gets to certain parts of the meniscus don't have a good blood supply. It's interesting actually, if you do a meniscus repair, again, sewing the meniscus back together at the same time as a coexisting ACL tear where you're doing an ACL reconstruction, the healing rates of that meniscus are actually a lot higher because you have the blood from drilling the tunnels to pass the ACL graft. That blood gets in the knee, gets into the repair site, and brings the inflammatory cells, or at least this is how the theory goes, and gets that meniscus, basically the repair, the stitches, to help the meniscus heal. So the success rates are actually higher for that meniscus repair to heal in the setting of an ACL tear than what we call an isolated meniscal repair, where the meniscus tear is the only injury, you go in surgically and you try to repair it. Again, good success rates, but not great. Yes, you can have it completely heal and then it re-tears. More often though, what I see is one that just doesn't heal in the first place. You get 4 months, 5, 6 months, maybe 8 to 12 months, and you just still have discomfort in the area of the tear. And if you go back in surgically and scope it, worried that there's a second tear, you see that it basically just never healed. And so sometimes in those second operations, you do end up having to trim that entire part of the meniscus out. So, those are, again, the rates, and if you look at the data, can be anywhere from about 10% up to really as high as about 40%. Again, though, if you have the chance to repair, especially a young athlete that's got many, many years of being active ahead of them, decades and decades in front of him or her, I think if it's possible that, the meniscus is a certain type of tear, certain location that can be repaired, as orthopedic surgeons, especially sports medicine orthopedic surgeons, we try to do that. Now, have you had a meniscus tear that was sewn back together by the orthopedic surgeon, or are you about to undergo that surgery? How did it go? Did it heal, or are you trying to get back to sports? I'd love to hear your thoughts and your experiences, and I'm sure other people going through the recovery process after a meniscus tear and after a meniscus repair would love to hear your thoughts as well. So below this video, leave your comments. I'd love to read them, and again, I think it helps other people dealing with the same problem. And along the same lines, if you know somebody that is going through a meniscus tear, maybe needs to have it sewn back together by an orthopedic surgeon, or may already have done that, I would really appreciate it if you'd share this video with him or with her, so that maybe it can provide information that's valuable and helps them have a better understanding of what they're dealing with. Now, if you like videos like this and you want more information on sports and exercise injuries, and injury treatments and injury prevention, subscribe to my video channel. I record a couple of these videos every single week, and I'd love to deliver those directly to you. And last, go to my website, drdavidgeier.com. There's so many resources I create, audio, video, written, and they're all about ways to stay healthy and perform your best. And I'd love to deliver those directly to you, completely free, but just go to my website and enter your name and your email, drdavidgeier.com, and I'll deliver those directly to you. Thank you so much for watching. Again, meniscus tears are so common, and it's such a common surgery that we do as an orthopedic surgeon, so I really enjoyed talking about this. I really hope it was helpful, and I look forward to seeing you right here next time.